So Anna, you've championed access to care and actually gotten into place a couple of different laws. If you wouldn't mind, tell us a little bit about the story about Ava's Law.
Yeah, I mean, it's interesting because I didn't have anybody in my family at the time, or actually didn't know anybody with autism. My daughter was diagnosed in 2006, and there was no coverage. So the diagnosis was pretty obvious because she was at the time very affected by autism,
Mhm.
but we received a letter from our insurance that autism was excluded. And that really led me to try to understand, what do you do when that happens? And, I think life's journeys are so, interesting. My uncle was in politics at the time. And so I went to him and he said, well, you need to pass a law. And he made it sound so easy. This is kind of funny, but I'd never even been to our state capitol. Okay, that's kind of sad to admit, but I'd never even been to the capitol. And I thought, but I met a few parents who also were, through Facebook, were trying to do something similar. And we started working in 2009 to pass Ava's Law, and it took 6 years to pass legislation here in Georgia. A lot of complications around mandates and the dollars that get associated with that, and things like that. But we did that, and then we got Medicaid coverage also, which was huge, right? Because so many of our families are covered by Medicaid here, and it was worth every second of every day.
That's awesome. That's awesome. So, Anna, you've opened a rural clinic in Georgia to help meet some of the immediate community needs for ABA services and for autism services. Um, what has that experience taught you, even beyond some of the experience you've already had in your career?
Yeah, so it was very interesting, Tim. My nephew was diagnosed with autism a year and a half ago, somewhere like that. He was 2.5. And as hard as I've fought for services in Georgia, there still is this gap in rural areas. We live in a very rural area in South Georgia, Vidalia, Georgia. And there's still a gap, right? And so a lot of children who are diagnosed in rural areas are receiving telehealth services, or they're driving, their families are driving if they can, right? So there's still this equity gap here, right? Where if you can afford to not work and drive your child to a place, or if you want to get telehealth, which is certainly not ideal for a 2.5-year-old. So a friend of mine who was retiring as a BCBA said, I'm happy to come and help you, and we can do in-person services and just start out with a few kids and really just try to see what we can do to meet some of the needs in your community. And we've just been trying to do that ever since. And it's hard. It is, because it's hard to find clinicians, and we don't want to do telehealth, right? So that creates an environment that is harder, right? Doing telehealth is obviously pretty easy, but it's really been incredible to see, how you can make it work for rural families. And we've hired some amazing staff who are just in this community and want to work and want this to be their life, and that's pretty awesome.
Yeah, that is awesome. That is awesome. And it's never an easy challenge, but you're doing work that needs to be done for the families in the area.
Yeah, it's been very rewarding, but also very eye-opening too, because there's still a lot of work to be done in the autism community, because a lot of the children and adolescents that are coming to us for, with needs, are between the ages of 8 and 14. They did not get any early intervention. They didn't have the opportunity. They're in the school systems, and their needs are much different. They have more challenges than a child might have who got early intervention. And I want to find a way to meet that population where they're at too, because they deserve services.
Absolutely. So our next question then is, what are some of the biggest misconceptions payers still have about ABA services? And how do you think those of us in the community can actually help start bridging some of those gaps?
Yeah, I mean, I think that misconceptions payers have probably are still along the lines of what it takes to carry staff and to continue to provide services, and also just to get kids into treatment while you're waiting on the payer to authorize service or to credential a staff, right? So whether you're a very small company, whether you're medium, whether you're large, I mean, it still is you putting out money to be able to start hiring people that may not be able to work. For a BCBA, it could be 90 days or more. For RBTs, it's at least 3 to 4 weeks probably. So I think there's some gaps in understanding access where we all want kids to have access, and especially kids who have been on a wait list for 4 months, 6 months, maybe a year. And how can we better get them into care faster, or at least get them an assessment done while you're hiring staff, right? So, I mean, to me, that's still a gap where, I get that there's policies, there's rules, there's procedures, but we're all trying to get that child into care. And it seems like there's just kind of this gap in understanding for providers. We're bringing in staff before we get paid. We have to. There's no other way to do it. And we're doing our best to get those kids services, right, as quick as possible. So I think that's, to me, the biggest gap that I currently see, that seems to be a disconnect where both parties have the same goal, but just the understanding of what it's taking to get there. I think we can improve.
Yeah, absolutely. Absolutely. Well, and I think that's especially true for smaller rural clinics, right? Which is what you
Right.
guys are running. I mean, it's especially hard because you don't have a venture capital group fronting a couple million to start for the first couple of months.
That's right.
Yeah, that makes complete sense. It makes complete sense. So what keeps you hopeful and motivated in this field? It is not an easy place to work. You have challenges every single day. What keeps you motivated and excited and able to keep kind of coming at every day with the energy that you do?
Yeah, when you asked me that question, interestingly enough, tears come to my eyes. I don't even know why, because, you kind of think, sometimes I think I would be pretty calloused from working in this field for over 15 years and things that are still so hard and kids that still don't have access. And it is a frustrating environment a lot of times. And in the healthcare environment, it's frustrating. I'm sure a lot of people could say that who work in healthcare, not just with autism. But I get to be the mom of Ava every day and see how far she came from when she was diagnosed, the amazing things she does on a daily basis, who she is as a person that I get to experience with her. And that makes me so hopeful, because that, I want every child to be able to have their opportunity to express themselves. And then when I see kids making progress, I just know we have to keep the good fight. We have to. No matter what, we have to keep the good fight, because kids deserve health care. I mean, that sounds crazy, but if you're diagnosed with autism, you deserve that chance. And I've seen kids make incredible progress, and that's what gets me up every morning.
That's awesome. It makes complete sense. I think having a child with autism is probably the single best motivator you could have to push for progress and to push for good quality service and good quality improvements.
Yeah.
That makes complete sense. Makes complete sense. So last question I think that we'll get in today. For providers navigating incredibly complex reimbursement landscapes and processes, what is one kind of foundational element or area that they should focus on?
That's a really great question. I think that you really have to know the area, right? You need to do your homework and know the situations that families are in those areas. And what I mean by that is, one, are there diagnosticians? So are kids getting diagnosed, or is there year wait list just to get a diagnosis, right? And what are the barriers there? So are there language barriers? Is it an area where it could be, a high area with a lot of Hispanics like my community? So you've got to be able to have therapists that are going to be bilingual. These are just things that when you go into area. And then what about BCBAs? How hard is it to get a BCBA? And is it going to be a situation where you might have to do telehealth? And are you prepared for that? Right. So I think those are things when you look at an area, you have to really understand the population there and be able to meet the needs of that place. Because just because you could do that in one area, it doesn't always replicate to another area. every area just doesn't translate the same.
Yeah, yeah, that makes sense. That makes sense, and I think that's the case for most services, right? It's just
Right.
not everything transfers. You have to take it one step at a time.
That's right.
Yeah, that
Yes,
makes complete sense.
absolutely. And your payers certainly play a role in the big picture,
Yeah.
right? There's areas that are a lot tougher to go into than others, but at the core, if you don't really have an understanding of the population in that area you're going to serve, it really doesn't matter what happens on the payer side. That's kind of at the core of what I think has to happen first.
Full service has to happen first
Right.
before you can worry about how much or where or when you're going to get paid for it.
Right.
Yeah, that makes perfect sense. Makes perfect sense.